Now, over the past year, the Apalachee Center says they've seen a 20% increase in children struggling with a mental illness from the pandemic. Now, I found out how one program has made a difference in helping them keep up with the demand. School and work went online. People wore masks and social distance.
We've all had a lot of changes over the past year and a half.
Emily PRITCHARD is with the Department of Children and Family Services. She says those changes became a tough reality for kids.
Our kids are going into school or out of school, or they might have to spend time quarantined or away from their friends. So they might not be able to participate in the social activities or have that peer support that they've had previously.
She says this caused increases in depression, anxiety, and behavioral issues, admitting many kids to the Apalachee Center's BEACH unit, which stands for Behavioral Excellence in Children's Health.
It's a children's acute inpatient psychiatric unit which serves ages 6 through 18.
Jay Reeves is the president and CEO of the Apalachee Center. He says the program was first established in 2018 because the need for children's psychiatric care increased. From 2017 to 2019, Reeves says there was a 17% climb in cases each year, but for 2020, it was even higher at 20%.
One of the big things that we've seen has been with the virtual school that's been implemented. I think one of the things folks didn't necessarily anticipate with that move was because of the level of structure that school provides most kids, parents just can't do that on a 24-hour basis.
The pandemic has also added more stress for parents, increasing the Department of Children and Family Services child abuse cases to more than double.
These kids are really dealing with the aftermath of what their parents are going through as well.
Jamie ADLETA is the director of the Children's Psychiatric Unit at Apalachee Center and works with these kids directly. She says the BEACH unit helped 555 kids in the past year alone.
If your child broke a bone or had issues with their blood pressure or diabetes, you would not hesitate to take them to the hospital. So if your kid is struggling, whether that be anxiety, depression, or any other form of mental illness, that we're here.